Hi everyone, thanks for joining me for vlog number 9. This is Marianne, mental health social worker and certified hypnotist, coming to you from my mental health counselling and hypnotherapy practice. In today's vlog, I'm going to be talking about how we can access mental health services when we are having issues with our mental health. Since starting these vlogs, I have had a number of messages to my Facebook business page asking me how to go about accessing mental health support. So I thought it might be helpful to outline some of those services today and how to go about accessing them. So beginning with telephone counselling services, there's a range of them out there and most of them are 24-hour, starting with the Beyond Blue support line, Men's Helpline, the suicide callback service, 1-800-RESPECT, Lifeline and Kidshelpline. These services are offering brief support, and so obviously their support is time limited, it's not ongoing, and they can be accessed obviously from the safety and the comfort of your own home, which is a positive for people who may not feel comfortable accessing face-to-face services or who may not feel comfortable leaving their home. And then moving on to clinical mental health services. These are located out in the community. They are government-run services, generally linked to a public hospital. These services are usually for people who have clinical mental health issues. So those are mental health issues that are quite serious and ongoing. So the service that's provided by clinical community-based mental health services is generally a case management model where you will be working with a psychiatrist, a mental health nurse. You might also work with a psychologist or a social worker or an occupational therapist. They generally don't provide counselling. It's, as I said, more of a case management model where your medication is managed and your safety is managed as well. Moving on to counselling services. So if you are wanting counselling services, there's a number of non-profit organisations out there like Community Health Services and other non-profit organisations like Anglicare that offer counselling in an ongoing capacity. So they're generally staffed by trained counsellors, whether that be social workers or psychologists, who can provide you with counselling and support in an ongoing manner. In terms of the support I provide, I'm a mental health social worker, so I accept my referrals from GPs and I provide counselling and support in an ongoing capacity. I see my clients anywhere from 2 to 12 sessions. And we work on different issues. It may be that people have had some sort of upheaval or change in their life. It could be that they've lost a job or they've had a relationship breakdown. They could be dealing with some past trauma, and we work on managing those issues together. I'm very client-centered, client-focused, so I will work with the client where they're at, and we'll look at assisting them to make some changes, come up with some strategies for them to cope, and look at changing their lifestyle or whatever is impacting on their issues as well. If someone's wanting to access my service, they need to attend a GP and get a referral, which is a mental health care plan. So request a longer appointment and you will sit with the GP and together you'll do a mental health care plan. That will entitle you to 10 sessions under Medicare, and you will receive a $74 refund per session, and there will be a small gap to pay each session as well. If you are low income and you can't afford to pay that gap, you can request what is called an ATAPS referral, and the ATAPS referral will then give you 12 sessions for free, but there is a criteria to meet. So you need to either be unemployed, low income, or have a severe mental health issue or be suicidal. I work under both Medicare and ATAPS, so I can accept my referrals from either of those programs. So I hope that has been helpful today. I will list the numbers for the telephone support services and the area mental health services in each state in this post. And just remember that help is out there. It is generally just a phone call away. So please, if you're struggling, please reach out and make that call.